but they are like little sponges wanting to know all the things all of a sudden, and see and touch and smell and hear all the things, right? And taste, put everything in their mouth still. So their cognitive growth is really advancing significantly during this time. If you've ever been around a toddler, you know their favorite word is no. They learn how to say that, and then they say it to everything, even though they don't sometimes know what it means. But then they learn that something is their own, this is mine. They're very egocentric, or they want something, so they're just very self-centered little toddlers that they don't really have the capacity to think about others yet. They just think about themselves. So that's very typical toddler behavior. So because of that, they're trying to establish autonomy. What's autonomy mean? Say it again. I heard somebody say it. The right to make your own decisions, right to be independent, to be self-sufficient, and you choose when you do what you do, right? And when you do it and how you do it. So we want them to do that. We want them to be independent, but then we have to worry about safety issues, right? I'm going to get this other little microphone on. By the time they're about 2 to 2.5 years old, they're about 4 times their birth weight. Is a kind of typical statistic that you see. They're going to grow about 3 inches in height per year, and by around about age 2, they should be about half of what their adult height is going to be. So if you have a 2-year-old, when you measure them at age 2, and you can kind of get an idea of how tall they're going to be as an adult. It typically works out that way. The other thing that we're looking for is that anterior fontanelle to close. Remember, it's by 18 months. So it could be any time between 12 and 18 months. But it usually is by, sorry y'all. Let me get this on. Usually by 18 months. Technical difficulty, right? 18 months. So we want to see that fontanelle close. So when they come for a well child checkup, remember the posterior one should already be closed. When does that one close? I'm just going to get y'all to bring that back up. 6 to 8 weeks. So that's super early on, that posterior one. The anterior one, which is up here on the top of the head, it may not close all the way to 18 months. So you'll see it vary between 12 and 18 months for that one to close. So just thinking about all the different body systems, everything's growing, right? Their brain is growing like a lot faster than the rest of their body sometimes, and that's why their cognition can improve and get so much more complex during this time. Their brain is about 90% of their adult-sized brain by the time they're 2. And if you see a 2-year-old, a lot of times their little heads are like the same size as the rest of their body, right? And so that's just how they grow. But we also have increased myelination. What is myelination? What does that mean? What's happening when myelinization is occurring? It helps with faster transmission of information from the brain to the body, but why? You're making the myelin sheath around all of your nerves, and all your neurons are getting coated in that myelin sheath, which kind of protects it, which just helps information transmit faster. And that's why as you get older, you can do things faster and think faster and more complex and all that. So just getting down to the pathophysiology of the brain and how that works. The other thing that is important for is we need the brain to tell the body that I can hold my pee or my poop and I don't have to go to the bathroom yet and I don't need a diaper anymore. So they have to have that brain development has to be in place before they can even consider thinking about potty training. So that's why sometimes that doesn't happen until about 18 months to 2 years that you would start potty training, because that's when that myelinization is kind of getting more and more stronger and complete, as you would, if you would say that. So respiratory wise, increased alveoli. So we know what happens in the alveoli in your lungs. Gas exchange, right. So if you have more of those to do the gas exchange, you can have improved gas exchange, right? So this is one of the reasons we see kiddos, you guys that have been to the infant toddler unit at Children's and you had a kid with a trach on a vent and they're like a year old or roundabout, sometimes by the time they get 3 or 4 years old, they can come off of their vent, come off of their oxygen, and it's because their lungs are still growing. And they actually sometimes can come off of some of that stuff later because they have more capacity for gas exchange and air exchange.
Is that why the respiration is slowing down?
And that is why the respiration rate slows down too. Yes, correct. We talked about the eustachian tubes and infection. They're short and straight, kind of throughout toddlerhood. They'll start slanting down maybe closer to preschool age, and then as they grow, just kind of over time. But so they're still real high risk for ear infections. And of course, musculoskeletal, their bones and muscles are just growing, so they need really good nutrition. And we know toddlers are notoriously picky eaters, so getting them to eat the nutrients is really important so that their bones will be strong. But they have this typical sway back and pot belly. I'm just going to show y'all my pot, just like this. But they're kind of bow-legged too, that's a normal finding in toddlerhood, right? But we want to see that kind of straighten out as they grow. Cardiovascular heart rate kind of decreases, blood pressure increases. Just as their vessels get stronger, their heart gets stronger. Genitourinary, their bladder capacity increases over time, right, just with growth, but that's important for potty training too, because they've got to be able to have a capacity to hold some of their urine for a little bit longer too. The urethra, however, still is short, so they're still at higher risk for UTIs. So when they're potty training, it's really important for good hygiene, especially with females, and teaching parents how to use good hygiene for when you change diapers with girls, you always wipe front to back, right? We don't want to bring any germs forward. So that's still important for them too. What's important for everybody at every age, I guess. But they're still kind of at a higher risk for UTIs because of that, just physically, because of their urethra being still kind of short. Gastrointestinal, their stomach increases in size, their pepsin production is maturing to help things digest. So this is why we can transition them to eating like 3 meals a day, like we do. And 3 meals a day, 2 snacks, whatever kind of works out for them. But instead of taking a bottle every 3 or 4 hours, they're transitioning now eating table foods. And with potty training, sometimes bowel control happens last. And they usually have that by age 3, but sometimes that one's a little trickier for them to control, and that's kind of just normal. They usually get bladder control first whenever they potty train. So again, they want to see and touch and hear and smell and taste all the things, so we have to give them a safe place to do that. They might start learning that they prefer certain smells or textures just as they learn, but they want to let them touch everything, but safely, keep them, supervise them and make sure they're not swallowing things or putting things in their mouth that they shouldn't. The hearing is intact at birth. Hearing intact at birth just means when a baby's born, their hearing is either intact, or if they have a deficit, it's there. It doesn't improve over time like vision does. Babies, they can just see those contrasting colors. That's why we like the black and white patterns for infants, because they can actually decipher those. And then their visual acuity, which is just like the sharpness of your vision, it just improves over time. So it's just continuing to do that through toddlerhood too.
Thank you.
So I've just thrown in the vitals that you guys have on your on the handout that we gave you, the ranges that we're using. Just included those there. This is a picture that a friend let me use, and this is her baby at 18 months. That's him actually at 4 years, so he's out of toddlerhood, right? He's preschool, but very typical toddler look here. That little pot belly, their head is kind of same size as their chest. Head circumference and chest circumference are usually about equal when they're around 18 months to 2 years. And then they just grow, their abdominal muscles kind of strengthen and they just kind of straighten out and look a little more proportionate when they get out of toddlerhood. He's super cute. Okay, so let's get into the different developmental theorists. And we already talked about autonomy, right? Being able to make your own decisions, being independent, having the ability to choose for yourself, right? We want to allow toddlers to do those things in a safe way, but that's what they're trying to do. They're trying to be autonomous. They're trying to be independent. They want to be able to choose if it's okay for them to choose. And that's why we usually say if there's something they're wanting to do, then give them 2 options, the red one or the orange one. And okay, I'm not going to hand a sucker to a toddler, right? But give them 2 things to choose from that are appropriate, that whichever one they choose is fine, and then that gives them like a sense of independence that they got to choose it for themselves. So this is a big part of the psychosocial development. They're trying to be autonomous, so autonomy versus shame and doubt. So if they don't feel like they can be independent and make their own decisions, they might feel shameful or doubt themselves or kind of affect their self-esteem. So the other part of this is think about a 12-month-old infant has now learned to pull up and they're cruising, holding on to stuff, walking, and one day they let go, right? And they're off. They're gonna walk, they're gone. So, but maybe this was mom or dad, and now they've literally physically they can separate from their parent. So they can go and be in a room, find themselves in a room down the hall by themselves, and then what do after that? If you ever had a toddler, and they realize they can walk down the hall to the other side of the house or to a whole different room of the house, and they get in that room and they look around and no one's there, and then what? They get freaked out, don't they? They're like, oh my gosh, I'm all alone, and then they cry and whatever. So that's a big step for them because they've actually seen that they can be separate. They can envision themselves as their own person, I guess now. They can see they're not a part of their parents anymore as much as they were. So this is where we get negativism, which is saying no to everything, because that's a way for them to express their independence, and they made a decision, no, I don't want to do that, and temper tantrums happen because they just don't know how to process the emotions, right? They get these big feelings and they want to do it themselves, but they can't, or they want to do this, but mom and dad won't let me, and I'm going to throw myself on the floor and scream and kick until someone gives me what I want. And sometimes adults do that too, and we just have to grow out of it at some point. But so they're just trying to learn how to relate to other people while realizing that they're an actual individual person and they can kind of do some things on their own, and then they have to figure out how to navigate all that. So one of the ways they do that is by imitating the people around them. So in a minute, we'll talk about domestic mimicry, where they like to vacuum and do dishes and do the household chores that they see mom and dad doing because they're just, what did you say? Oh. Until they get old enough to realize that that's not fun. Right. Yes, exactly. But they want to do what you're doing. They don't necessarily understand what's happening. They don't know that they're cleaning the house and being productive yet. They just know that they're copying what you're doing, and that's sort of satisfying to them because it makes them feel big and independent, right? Yeah.
I'm sorry. So we're about autonomy, the shame and doubt, in a temper tantrum. How the parent responds, is that going to affect their stage?
Yes. So she's asking how a parent responds to a temper tantrum, which I do have some information on later. But one of the things with does that affect how they?
This stage of their development.
Absolutely.
So
yes. So the recommendation of how to respond to a temper tantrum is to kind of ignore it as long as they're safe. As long as they're not, and what do we know toddlers also do during temper tantrums? They bang their hands and legs and then they start banging their head on the ground. No, we're not doing that, but you can come over here and sit in this chair and scream all you want. Okay, you sit there and scream it out, you know, like we don't want them to hurt themselves or anyone else, right, or break something. So as long as we don't leave them alone. You don't put them in a whole room by themselves either. You stay with them, stay nearby, but ignoring the emotional response other than saying, okay, that's okay that you have those emotions, you know, acknowledge their emotions, but you're kind of ignoring that they are acting out, you know, you're ignoring that part of it.
And they have the decision to stop.
So try to have a good routine in place. Toddler knows what to expect. Then they can decide, or they could not decide, but they know it's time to go get ready for bed because this is what we do every night. We do the same routine, or they know that it's time to sit at the table and eat lunch with the family. You know, they learn to sit up at the table with everybody and eat when the family eats, but they can use their favorite plate and cup and spoon, and maybe they can pick that out with you while you're cooking dinner or whatever. So lots of ways to incorporate them into things that you're doing every day, but giving them somewhat of a routine throughout the day is a huge deal for toddlers that they actually respond really well to. And it can kind of prevent some of getting to the point of a temper tantrum because they've been allowed to choose. They've been, like you've let them choose things along the way that kind of gives them a sense of that autonomy where then they feel a little more in control. Because they just want to kind of be in control of the situation, but obviously we can't let a 2-year-old be in control of all the situations, you know, but that's why we give them a chance to do it on their own in a safe way that is appropriate. So if you can get that on the front end, it can kind of negate some of the problems that come up. That's a challenge though, right? Especially when you have other kids, you're working, they're going to daycare, they're going to visit family, whatever's happening, right? Life happens. So it doesn't always work out that way, and sometimes you just have to do something because you have to do it. That's also just life, right? And so that's a hard lesson for everybody to learn, I think. And so toddlers kind of start learning that part of it too a little bit. They don't really know how to take turns. So that second picture, that's like a typical, you put 2 toddlers next to each other. When toddlers are next to each other, they don't necessarily interact with each other than to steal what the other one has, right? Like they do that parallel play we'll talk about in a minute, but where they're just beside each other and they're independently playing with their own toys. But once one toddler sees what the other one has, they're going to try to snatch it, you know, and then they cause one of them to start crying or whatever. So they don't know how to process their emotions, and they still communicate some by, like they're learning to talk, but infants communicate by what? Crying. Maybe they learn to start making noises. Toddlers are still in that some as they get into the early stages of toddlerhood. Is that communication? I'm mad, so I'm just gonna cry, you know? So that's just how they process their emotions. So that's just typical toddler behavior. And this little meme too, I'm really hungry, but Dad gave me a purple spoon instead of a pink one, so I can't eat. And they will literally not eat because they didn't. And you know, you can treat every situation individually of how you handle stuff like that. But if you're able to let the toddler pick an appropriate, pick from appropriate choices and let them choose, things go better sometimes on the back end. So talked about cognitive development advancing significantly. So some of the ways that happens. So we'll talk about Piaget is the theorist that we talk about when we talk about cognitive development. So he theorized that they're in that sensory motor stage, and y'all talked about that in infancy. And that just means that you're using all your senses to interact with the environment, right? They can't walk yet, they can't talk yet, but they can touch and see and hear and taste, right? So early in toddlerhood, like 12 to 18 months, they're still in sensory motor stage until they're 2 years old. So they're still using their senses to explore and interact with the environment. But the early stage of that is tertiary circular reactions. So what did y'all learn about that in infancy? So they start as primary circular reactions. What is the primary circular reaction? What's an example of that? And I kind of have one there, but sucking their thumb, sucking a pacifier. And that's just if you think about it, a primary circular reaction is just a very primitive reaction to something. Bless you. This feels good, so I'm going to keep doing it. And then I've got that feeling again, so I'm going to keep doing it. But it's that one singular action. It's not complex. It's not a complex way of thinking. So you get to secondary circular reactions, which is that later part of infancy, where I made something loud, I like that. I'm going to do that again. But it's just this thing, maybe they're rattled, right? They have a rattle in their hand or something. That's kind of what it starts with usually, because that's typical baby toy. Or they learn to kick their feet on the bed or something, but this is just a very singular thought but now they're making like noise, they're making external things. It's not just internal, like sucking an internal feeling, like a primary one is. So then we talk about tertiary circular reactions to mental combinations. That just means that we get into a more complex way of thinking, is just how it progresses. So after they kind of figure out secondary circular reactions, they move into the tertiary circular reactions. And that is, oh, I did that. Now what can I do? Can we throw it at you? Dump it out on the floor, right? So they just see more things, more reactions they can get. So they've seen the reaction that it makes. Oh, I like the way that sounds. Now I'm going to take it and dump it in the floor. Wow, everybody has to come pick that up. And everybody yelled when I did that. I'm going to do it again. So that's literally like tertiary. That's what a tertiary circular reaction is. It's just a more complex added on to, I'm going to do something, I get a reaction that I like, so I'm going to do it again. But tertiary is, but let me do something different and kind of keep going with that. So it's just more complex thinking. And that's why you teach a toddler that they learn to stack blocks, let them knock the blocks over, see what happens, and they can stack them again. And that's a really good activity for them to do that really helps their cognition. Because they learn that it kind of helps with like object permanence too, where something exists in a certain form and now it's different, but it can exist like that again, stacking the blocks back up. And we'll talk about object permanence more in a second. But so you see how the sensory motor stage progresses. They just start playing with everything, and they're like a little sponge getting all the knowledge they can. They want to see everything and touch everything and experience it. So then they move into the pre-operational stage, which is from age 2 to 7. So that goes all the way through school age years. And so very early pre-operational thinking, they develop more symbolic thought, such as, I'm eating out of a cereal bowl, and now I'm going to put this bowl on my head and it looks like I have a hat on, right? Like they can use objects maybe not for just what they're intended for. So just like things like that, they just start learning that, I'm using the broom, but now I can pick it up and hit stuff with it, just more complex ways of thinking. So as they progress through that, they're also, they're mimicking other people around them. That's the domestic mimicry, when they mimic you doing household chores and things around the house. Increased object permanence. So what's object permanence? You see something, it goes away, but you know it's still there, right? Like they hold a blanket up in front of them. Peekaboo, all right, peekaboo is kind of the very preliminary part of object permanence because you cover your face up and they think you left the whole room. But they start to learn to look behind there, right? Like you hold a blanket up in front of you and a little bit older infant even, and an early toddler, they'll look behind the blanket to see if you're still there. That's object permanence. But it just increases throughout toddlerhood so that if I had my cup here and then I set it here, they know that's still a thing that I just put it away. Like they'll start even when it completely disappears, not just behind something. So this is really important for mom and dad that had to go to the bathroom for 2 minutes. They're behind that door. I know they're back there. I know they still exist. And what do? Stick their little fingers under the door and try to get in, right? Like, I know you're in there. It's been 60 seconds. No, they don't say that, but you know, they do not like it when mom and dad go to the bathroom and they can't see them anymore. But because of this object permanence idea of the way their brain functions, they start to learn that even though you shut the door, that you're still behind that door. So as that just keeps progressing throughout toddlerhood, that's important for things like separation anxiety. When kids know that mom's going to drop me off at daycare, is she going to come back and get me? That's really hard for toddlers, right? They can have major separation anxiety, especially early on. But as their brain develops and they learn more and more that things do still exist when they're not in my view, that can actually help with that too over time. They start to be able to follow instructions, like a simple thing. Go and set your cup on the table, but maybe later in toddlerhood, go set your cup on the table and go sit on the rug. Like that's like a 2-part. They can start following more complex instructions as they go through toddlerhood. And then their play just becomes more complex. Initially, they're just mimicking people around them, or they're just imitating sounds. But as they start, they'll just start discovering things. They want to know everything about this. What is this? And they start saying, what's this? What's this? Like when they start talking, right? They want to know what everything is around them. So just very curious, and because of that, we have to make sure they're safe too. Is Siri talking? So I was trying to convert a temperature to Celsius to Fahrenheit for the test. I just want to make sure those match up, right, when I put one on the test question. And sometimes I just ask Siri, because she'll convert it for you. And she said, I'm sorry, I cannot convert Celsius to Celsius. And I think that would be a bit self-fulfilling. Because apparently I said whatever the temperature was in Celsius to whatever it was in Celsius again. And I was like, well, thanks a lot, Siri. I was like, did she really just say that? It would be a bit self-fulfilling. So as the toddler progresses through, a lot's changed. Think about a 1-year-old to a 3-year-old. The way they understand the world and interact with things, it changes significantly. So these kind of things is kind of as they progress through toddlerhood, there's not a hard and fast age that they might do everything at a certain time as far as how they understand things, but they begin to have memories about things. Like they'll remember that when they went to grandma's house, they did this activity when they go back again, and they'll want to do it again, and they'll start learning that kind of stuff. They'll start sorting objects. That's why those little shape sorter toys are so good for them, to put the square in the square hole and the circle in the circle hole, things like that. And towards the end of toddlerhood, they start playing make-believe. They like to play dress up because they like to imitate, right? But for me to dress up, or toddler to dress up like, I won't say me, I might want to dress up like a firefighter. This is the example I was about to use. A toddler to dress up like a firefighter, like dad or mom or what, let me dress up like whatever my mom or dad does for a living. They're just kind of imitating them initially. But later they start to understand what that means, that I'm a firefighter. You know, that's more like make-believe, right? Right, at first they're just putting dad's big boots on because I can wear his boots around the house or whatever. But kind of towards the end, when they're a little bit more advanced, then they'll actually pretend, and that's big in preschool age too, when they want to play dress up and pretend that they're somebody else. But they kind of start doing that towards the end of toddlerhood a little bit. So I talked a little bit already about object permanence, but it's not just peekaboo. I talked about stacking blocks, and they knock the blocks over. It kind of helps them establish object permanence in that way too, because they can learn that those blocks that are now messed up on the table can still be a stack. And so that's why we encourage toddlers to stack the blocks and knock them down and stack them again, because it just helps with their cognition. It helps them understand that object permanence too. Same thing with like containers. So if they have a big bucket, Dr. Gates' bowl is really handy for me today. And they put something in, they're gonna look, did I put it in there? Or, you know, maybe they put it in like a big bucket and then they go over and look at it, see if it's still in there. That helps object permanence. So think about in those sensory motor activities that and I actually brought a book. This was my son's book that I kept. But these books with like the flaps, you know, that have stuff behind them. Did anybody have this book when they were a kid?
Yes.
Yes? Well, half of them are torn off, dang. Here we go. So that's like object permanence. I know that stuff is still behind there when we close it and they want to look again, right? So they love board books initially, and they can start using like books with pages if they don't tear them up. But these kind of things are great for toddlers that help them establish that object permanence. Okay, so moral development. When you think about so we're talking about Kohlberg was the developmental theorist here that theorized about moral development. We're very early, it's pre-conventional morality, level 1. They don't have any awareness of what's right or wrong. They only know because you told them, okay? They're just very egocentric. They don't see anything from anybody else's point of view. But they say, because you said you can't touch this, that's the rule, and that's how it is because you told them. So they don't have the capacity to see that as, well, something that I could challenge or something like that. Not saying that they wouldn't touch, if that's kind of, I'm getting into like, if you told them not to touch something and then they go, you know, they do want to touch it, that's not really like a moral development, that's more trying to be independent, you know. But as far as when you get into like, they're not thinking about politics or religion or, you know, all of that kind of stuff. They just know that mom and dad said this is what we're supposed to do and that's what I have to do. And so, but if they do something and they get in trouble, then they don't want to get a bad reaction, right? They want a good reaction. So they're going to make their decisions to avoid getting in trouble, avoid punishment, or get a reward. So that's why positive reinforcement works really well for them too, because they want to get that good reaction from somebody for doing a good job and being a big boy or a big girl, you know. They love that feeling. As the toddler gets a little bit older, they do get the capacity to kind of feel empathy towards other kids or people, and that's why sometimes you might see a toddler like checking on a baby, but would you ever leave the toddler alone with that baby?
No.
Please do not do that, because that toddler does not understand that that's a living human being that they could harm, and they don't, and they won't do it intentionally maybe, but if the baby starts crying, they don't know how to handle that. Well, throw it on the floor, I don't know, you know, I don't want to play with that anymore. Yes.
Is this moral development over and whatever, is it similar to like Erickson in that on these different levels that they don't?
They do.
Well, on these levels,
Mhm.
they will do the word.
Yes, like Erickson says that if they can't achieve autonomy during toddlerhood, they have a harder time mastering the next steps, you know, the next stages. And that's kind of true for these too, yes.
I think about like
That's kind of true for their moral development too. Now cognition, we're talking about brain development and their level of intellect and how their brain is functioning. I mean, that has to progress too. But yes, moral development is kind of like the psychosocial aspect as well. Like, although some of this has to do with their brain development too. It's all kind of closely tied, but if you think about toddlers are just very egocentric because they just are learning to see themselves as an individual. They're not really aware of other people yet, except their parents and caregivers maybe, and they're learning to separate from that. So it's all just kind of a primitive way of thinking that they have. So do they get the capacity to have more ability to think about things like the world? Does that make sense? So I don't know that it's necessarily they have to master this skill. That's more for psychosocial to answer your question. But they do move, it helps them if they are moving through these stages and kind of getting to experience the things that go along with each one to then go on to the next stage. Does that make sense? I mean, they are all kind of closely tied, especially in toddlerhood, because they just have such a basic way of thinking anyway, and their thinking and learning and experiencing and interacting with others is just how they're interacting with the world. So their psychosocial development is really close to their cognitive development and really close to their moral development because it's all just very basic at this point. So as they get older, those things start to really differentiate more. But if you're talking about them doing something because they want to get a reward, that's moral development. That's like they're based on their morals, how they feel about things. Or you're talking about them interacting with other people, that's more psychosocial development. If you're talking about them learning that when I lift up this flap, there's something behind there, and I close it and I look again, that's really cognitive development. So if you kind of differentiate things that way, some of those examples, like if I asked you for an example of cognitive development, think about it, how they're learning and stuff, but they are closely tied. But yes, with the Ericksons, they do have to kind of master that stage. That doesn't mean they wouldn't move into the other stage and start experiencing the next things that they experience as a preschooler and a school-age kid. But we all know that some adults still have toddler qualities about how they handle emotions and how they, like, some people just have struggled with that, and so it makes it hard for them to master the next steps if they can't get past this one. And that's why mom and dad's reaction to temper tantrums is really important, and giving them a routine that they can go by, because it helps them set boundaries and it helps them understand that they can have boundaries and put those in place too. So it all kind of ties together in some ways. But older toddlers, you might also see like a kid on the playground falls and hurts themselves. Younger toddlers don't. They might look at them, at that person, the kid's crying or got hurt. A younger toddler might just stare at them, right? Like but an older toddler might go over and, okay, right? You kind of see it, little older kids, like older toddlers, they might start doing that. That doesn't really happen towards the end of toddlerhood, because they just don't have the capacity to think about other people yet, but they kind of start doing that towards the end of toddlerhood. That's a good question, Mike. So their emotional and social development kind of ties in with all that. Their temperament, that's just like how your personality is. Everybody has a different temperament. Some people are more laid back, some people are more hyperactive, some people are really shy and slow to warm up. They do say slow to warm up, easygoing, and difficult. I mean, a hyperactive kid can be labeled difficult. We don't want to label people like that. So I don't really like the term. I mean, that's just the terminology the textbook uses. But a kid who's more hyperactive and getting into everything, they are more difficult to handle sometimes, right? Because they're just, like, my kid was a runner. I could turn around. If he saw something he wanted, as soon as he figured out how to do that, he would just be running, and he would be so far away from me, and like, that is scary, little 2-year-old running across the field at the playground. Like, the playground's here, but no, he's off to the woods. I'm like, oh Lord. But a kid who's really shy, they may not do that. They might stay right beside you. They may not cause as much trouble in that sense. Might be a little easier to handle. But then when you think about a kid that's really shy also might have really severe separation anxiety. And when you go to drop them off at daycare or with someone else, they do not handle that very well. So we know toddlers, as they start exploring things, and they might be afraid to turn the lights all out at night to go to bed, so we're afraid of the dark. So we have night lights. We have different ways we can handle those things. Strangers, a lot of toddlers are afraid of strangers, but your hyperactive toddler, like my kid, he never met a stranger. He would talk to anybody everywhere we went. And I would have to really watch him, but so some kids that are more hyperactive like that, they can get into unsafe situations a lot easier. Loud noises, loss of their parents, they realize they can separate from their parents, but if they get too far, some of them get scared. But then they start to learn that the parent can actually leave, and they get scared that they're not going to come back, which leads to that separation anxiety. So routines help with that. Giving them a transitional object, which is just like their blanket or their favorite stuffed animal. You hold on to that, and then when I come back, we'll all play together or something, give them something to look forward to when you come back to pick them up. But give them something that they can use to self-soothe, because that's actually a form of autonomy. They're using that blanket or that stuffed animal as a way to soothe themselves, and that's actually something they're doing for themselves. So that's a way for them to be autonomous too. Okay. Let me see. We'll get couple more minutes and we'll take a break. So a little bit more on that, emotional and social development. We've already kind of talked about some of that. They're separating, seeing themselves as their own person, very egocentric though. But because they're trying to be independent, they say no to everything, but they also can be really aggressive with that sometimes. They can bite or hit. So we just have to really, role model good behaviors. It's not okay to bite someone else. It's not okay to hit someone else. It is okay to hit the pillow if you want to hit something. Go for it. Give them something that they can still do it. That's okay, but offering them limited choices that are still appropriate gives them that sense of autonomy. They're also becoming aware of their body, right? They're getting ready to potty train. They might see mom or dad and start to realize that I have different body parts than you. Why is that? What's that? What's this? What's this? And I want to show you in Walmart. What are these? Like they don't have any boundaries with that. But they're learning the differences, and they're kind of on a very basic level developing their gender identity. But a lot of that too is what we tell them: well, you're a boy, you're a girl. Boys have these parts, girls have these parts. They don't understand it on any higher level than that. We know all kinds of things can influence behavior of a child, but the cultural things that they're exposed to, their environment at home, what do they have a routine at home, or are they at home and running around the house while mom and dad are partying all day with their friends, and they don't have a bedtime, they don't have a specific room they sleep in? I mean, those are sometimes things you see that really can hinder a toddler from achieving that autonomy, because they don't learn boundaries, they don't learn. It's really important for toddlers to have like their own bed, or they might sleep with a sibling or something like that, but they have their own space, right? They have their little area where they keep their toys or whatever, and it's important for them because that kind of helps them learn those boundaries and how to, and kind of what to expect, because they go into a situation knowing what to expect when there's a routine in place, and so they do have to learn that that's not always, you can't always have a routine. You do have to get outside of that sometimes, but having that routine at home is just really good for their development. But If you think about kids that are in a family that's homeless or living in severe poverty, these kids may not have access to nutritious food, clean water, safe toys, things like that. So they can get exposed to things that are an environment that's definitely not safe for them when they're trying to learn everything. So lots of different, and anytime we come in, if a kid comes in for a well child visit, we want to know things about their home life, like what kinds of toys do they play with at home, what kinds of things are they doing. We're looking at those milestones, which we're about to talk about when we come back from break. So language development, early on it's echolalia. This is just repeating words like a parrot repeating a word back to you. They don't know what it means, they may not understand it, but they're just gonna echo it back at you. And then as toddlerhood progresses, they're going into that telegraphic speech where they're just using essential words, and that's why I put Cookie Monster, like, me want cookie. They're just using the essential words to express themselves. But receptive language, meaning what they understand, is far greater than expressive language. So if I tell them, go put your cup on the table and then go sit on the rug, they can understand what I mean, and as they get a little bit older, they can understand more complex commands and follow instructions, but they might not be able to say that sentence back to me. They might say cup, rug, me, rug, like they're just using the essential words because they're just learning all the things. So that's the difference between receptive language, what they understand, versus expressive language, which is what they can actually communicate. And as the toddler gets a little bit older, if any of y'all have kids, that they start saying things like a certain way, and we can understand them because we're around them all the time, and we know that they say corn chop instead of pork chop, because that's what my niece used to say. But if we told her she had to eat pork chops, she didn't want that. But if we were eating corn chops, she was fine with it. So, but stuff like that. But as they get older, they should start using the right words for things. And people on the outside should be able to understand most of what they're saying, So this is an example of that, where the toddler says something that parents know. All right, like, and y'all probably, if you've ever been around toddlers, they just want to watch cars. Why did the bleed? How do you not know what I'm saying, right? So they, and I mean, the dad might know more than what, that the mom knows, but it's just a perfect example of early on, they just use their own language to express themselves. But as they get further into toddlerhood and closer to preschool age, a person on the outside of the family that's not around that kid should be able to understand most of what they say as their language develops. And if they still can't, that could be a sign that language development is not where it's supposed to be. So this is totally normal early on, but that should get better. Let me see where I'm at. Yeah, okay, we'll do the milestones when we come back. So we break it down into the age groups, 12 to 15 months, which I had y'all do on your lecture prep. So y'all have already kind of looked at some of this. I'm not going to go through and read everything, but if you notice, we start out very basic. We're just learning to walk. We're just learning to talk. They say their first word. This is that. They just turned a year old up to about 15 months. And remember, with milestones, not every kid does the same thing at every age. We know that. But this gives us a benchmark to measure against. So that if there's a suspicion of a developmental delay, then we can measure and see, well, where should they be? How long did it take them to do X, Y, Z? We do give them, bless you, we give them a while to try and get those things mastered because it is different for every kid. So even if they haven't said their first word here, give them a little bit of time, but they should be doing that before they're a year and a half for sure. They should be talking, saying some words. Even if they don't understand the meaning of it, remember echolalia is them just echoing back. They might start learning that that's mama and that's dada, they can identify some things that they see a lot, but understanding what words really mean, they're not doing that yet. But we've talked about a lot of these things already kind of as we've gone on. Looks for hidden objects, so that object permanence. You hold something up in front of you, they're gonna look behind to see if you're still there. Throw something in a bucket, they wanna see in the bucket. That kind of also becomes important when they're potty training. Let them look in the toilet and see what they did and watch it flush down. Bye-bye. You know, this is a little early for potty training, but they'll be able to do that when they start potty training too. So by 18 months, we should be walking without any assistance. They can start climbing on things, which is really scary too. They can start going up and down stairs with assistance. And one of the things you'll see a younger toddler do is they go down the stairs and they put their feet together. They go down, put their feet together. They go up and they're holding onto the rail or somebody's hand. They have to put their feet together before they go up again. That's typical of a younger toddler that's just figuring out stairs. Also typical of an elderly person who can't do stairs anymore, you know? So as we regress back, we get the sway back and the pot belly and we can't do stairs anymore. So anyway, but that's kind of really typical of that early toddler figuring out stairs. They're learning to climb, but everything's just getting more complex. They start using those shape sorters. They can build a tower. I think I didn't say it on the first slide, but 12 to 15 months, they should be at least able to stack 2 blocks. By this time, we're stacking 3 to 4 blocks. Okay. They're saying more words. They're naming objects. Book, you point to something, or they might point to something. Mama, dada. I don't know if they learn bowl. You know, they can learn like small words and name different objects. Follow really basic commands. They're parallel playing with other kids. Not with, that's like oxymoron. They're playing parallel to other children. So parallel play, they just play by themselves, but they're next to people. They like being around people, but they don't really interact with those other kids other than remember what I said, to steal their toy because they want it, it's mine, you know. So fleeting contact with other children just means they might kind of notice that that other kid is there, but they're not really interested in what they're doing unless it's something they want. Assist with putting on and maybe taking off clothes. So that's an important step for potty training, right? This is kind of the time when you can first start thinking about getting into potty training with kids is around 18 months. That's kind of the earliest, and that's too early for some kids, and that's okay. But this is also the time when that myelinization is increasing and they can actually begin to have sphincter control, and their brain can tell their bladder what to do and things like that. So 24 months now, we're 2 years old. Lots of change between 12 and 24 months, right? We're running, they can kick balls and throw things and maybe carry stuff while they're walking, and they're more stable on their feet. They can build a tower of 6 to 7 blocks by now. Like, they should be stacking more blocks. So that's one of the things, if you're doing a well child checkup, the therapist, the doctor, somebody, they want to watch that kid play, they're going to hand them a bucket of blocks, most likely, or something they can stack, and they want to see what they'll do with it. That's part of kind of evaluating a child's development. They kind of start using that telegraphic speech, so they're stringing words together. Me, up. What's that? What's that? They want to know what everything is. And they start noticing that other people are having emotions. Whereas like a younger toddler, if somebody is near them crying, they might just stare or ignore it completely. So the little bit older toddler, they're gonna look at them like, what's happening over there? And then they start to realize, oh, they might be hurting. I know what that feels like. I'm gonna go check on them. I mean, are they verbalizing all that? No, but they're gonna walk over maybe and check on that other kid. So 30 to 36 months, That's 2.5 up to 3. And now we're climbing, running, jumping, pedaling a tricycle. They're just, they can just do a lot more stuff. But another thing that they do is they walk up and down the stairs and alternate their feet, right? They go with, and I know y'all in the back can't see, but they step up and they go on and step up to the next step because they can alternate their feet when they're going up and down the stairs. So that just shows their development has advanced. If you draw a circle on a piece of paper, they should be able to copy that next to you. They love to scribble and draw and paint and stuff, but things are just, their cognition is more complex and they have better fine motor skill development. Not only are they saying, what's that, but why? We gotta go to bed now, why? Gotta take a bath now, why? And then you go into a dissertation about hygiene and they're like, what? I just want to splash the toys. They don't care, But they just learn these different ways to ask things. And that's one of the characteristics of later toddlerhood is they want to know why we're doing things now. And if you think about the way their cognition develops, it's just more complex way of thinking to not only not want to know what something is, but why it happens that way or why it is that way. Another thing they can understand better is like the physical relationships. This is on top, this is underneath, this is inside, outside. They start learning those kind of things too. Okay, naming colors, following more instructions. They might talk about something that happened in the past. So this is like they go to grandma's house and they remember that we played this game while we were here and they want to play it again. Like just more complex brain development. So developmental delay, whenever we're assessing a kid, we do give them a wide range to do certain things. For example, walking. If they're not walking by 18 months, then we are concerned. If you have a 17-month-old that's not walking, but the mom says, but all my other friends, their kids started walking when they were like 10 months or 11, 12 months. Some kids walk early. We're going to give them some time. It's okay. Like, let's assess the whole situation and the whole picture, obviously, but we can give them a little bit more time. And then if they reach 18 months, then we need to investigate. This way, too, we're not having every kid in the doctor's office going, my kid can't stack 2 blocks, and they're this however many months old. So by 3 years, if they're not stacking at least 4 blocks, this is a concern. So that's like a big difference, right? We expect them to kind of do that around 18 months. That's a whole nother year before, or more than a year, but a year and a half that we're worried about it. So these are just things that we look for as they go along. But here's where we're going to say, are they doing these things by now? And if they're not, then we need to do further developmental testing. The tiptoe walking, I did put a picture there because tiptoe walking is associated with a lot of neurodevelopmental disorders. A lot of kids like to walk on their tiptoes when they first start walking. That does not mean they have a neurodevelopmental disorder, but if it persists, and it really persists even like months and months in, then that is after they've been independently walking, that's where we get concerned. Because usually they just are experimenting. They want to, they're just running around, and some kids do like to do that initially. But you can have the parent remind them, okay, put your feet down, and then when they start wearing shoes, sometimes that helps too. But it doesn't mean that they have an issue unless it really persists. And there's not a hard and fast time with that. That's one thing you're going to assess the whole picture. But that's one of those things that we look for too, to assess developmental delay or an issue. Okay. So I've already kind of talked about parallel play, but give them a safe place to play and give them all the toys that are safe for them to play with. Choose appropriate toys, which I'll show y'all. Limit their screen time. They don't really need to watch a lot of TV and Netflix and stuff, but toys that are age appropriate. We don't want anything with small parts, right, that could break off and they could choke on. Toys that promote their fine motor skills, their gross motor skills, interactive toys, domestic things that they can do domestic mimicry with, a little toy vacuum, a toy broom, dish gloves, stuff they can use. Anything that promotes them to be creative and that they can do themselves is great for toddlers. So I brought my toilet paper roll. So if it can fit through a toilet paper roll, you assume a toddler could choke on it. Basically, is kind of the rule of thumb. That doesn't mean they can't be left alone, or not left alone. That doesn't mean they can't have things that are small enough to fit through here, but they need to be supervised. But if you have a toy that stuff can come off of it, that could fit through there, that's a toy they don't need. So anything with small removable parts or sharp edges. Marbles, of course, are not for toddlers. Latex balloons, we don't give a toddler latex balloons because what could happen if they're trying to put it in their mouth and swallow it, or they aspirate it? Now you've got a latex balloon in the airway and there's no air can pass through and it's just trying to blow the balloon up and down. So that can be really bad. Small blocks like Legos, they need bigger blocks. Like those wooden blocks are great. They make big Legos too, but if it can fit through the toilet paper roll size, consider that it's too small. It's not safe for them to use without you right there with them, right? So, not safe for a toddler. So, toddlers are like sponges for knowledge, right? They want to learn and know all the things. So if a parent is considering sending their child to preschool, then they need to investigate the preschool and make sure that they have all the safety regulations in place. Having a smaller class size is always better, but having structured playtime and free playtime where the toddler can do whatever they want is important too. But all the things you think about when someone is learning to talk or communicate, just experiment with talking and singing and reading books. They love to read books and they love to help you turn the pages. Let them turn the pages, use the voices for the characters. They love all that stuff. Okay, so for promoting healthy eating habits, we know toddlers are really picky eaters. They also can experience what's called physiologic anorexia. Does anybody know what that means? No? Well, physiologic anorexia, remember their growth has really slowed down in toddlerhood. So their nutritional need is sometimes not as much. When they're not in a growth spurt, they won't eat as much. And for a toddler, that means they might eat like 1/2 of a chicken nugget and a noodle, and they're like, I'm full. Like, I need you to eat more than that. But parents will get really worried about that. So that's why we have to make sure they know that sometimes they won't eat as much, and that's okay. They will eat if they're hungry. But also their nutritional need is just lower sometimes because their growth is slowed down. And that's what physiologic anorexia is. Bless you. But that's why it's really important to give toddlers stuff that has lots of nutrients in it and don't offer them empty calorie snacks and junk food. Toddlers also get in a food jag. A food jag is like they will only eat chicken nuggets and nothing else. Or they only want to eat macaroni and cheese and nothing else. You can't get them to eat anything else. There's a time and a place for letting them eat so that they'll get some nutrition in. Also offering them other things and show them that you like this, or big brother, big sister will eat this. You should try it too, you know. But toddlers do get into that sometimes too, and that's called a food jag. But it usually passes after a week or two sometimes. But so offering them stuff with a lot of nutrients in it is really important. Promote them to feed themselves. That's a form of autonomy, right? We don't want to use food as a reward. We want them to start learning to eat at the table with the family and during meal times, and learn that 3 meals a day, 2 snacks is kind of what they're transitioning to. When they're about 12 months, or when they start toddlerhood, they should transition to a regular cup. So this is like they're transitioning off the bottle. They can transition off of breastfeeding, that's a personal decision with mom, but even if the parent, if the mother still wants to breastfeed, that's okay. But they still need to let them practice drinking out of a cup in between feeds, and they can offer them like water in a cup. So they can still breastfeed a toddler, that's a personal choice, right? But they do need to start practicing drinking out of a cup, even if they're still breastfeeding some. Just like they need to start eating table foods if they're still breastfeeding. They can sit up and if mom wants to supplement with a breastfeed at night or something, you know, maybe at nap time or something, some parents do that. They still need to start eating table foods and drinking out of a cup. So feed them nutrient-rich snacks and foods as much as possible. And then I've just got some things like limiting their milk. So milk is like cow's milk, they'll transition to cow's milk from formula. So if they still are breastfeeding, they may not offer them cow's milk yet, and that's okay, they can choose to do that. But cow's milk, we limit it to 16 to 24 ounces a day. Around age 2, you can switch to low-fat milk. Usually start with whole milk or 2% initially, and then switch it later. Limit the juice intake. Kids love to drink juice, but it's just so much sugar in it, and it sits on their, their teeth are just coming in, and they'll get they'll get cavities real easy if they're drinking juice a lot. So giving them water in between meals in a regular cup is good. They need lots of calcium for their bone development. We need to make sure they're getting iron in their diet, because our toddler population especially is at risk for iron deficiency because of them not eating as much or being such picky eaters. But a severe iron deficiency, if it gets bad enough, can actually cause developmental delay and like issues with their cognition. So that's why if they will only eat a little bit, if we can get them to eat something nutritious, that's the best thing. And cow's milk is not a good source of iron, so sometimes I think that's a misconception. People think, well, they're drinking milk all day, they should be fine, but they may not be getting enough iron in their diet. They might be getting the calcium, but not the iron. So prevent choking, we gotta supervise them while they're eating. Don't let them eat laying down or, playing around the house. They need to sit up at the table. Cut up their food for them, and we really don't want to give them anything that's like hard to chew. Remember, early toddler, they still don't have all their teeth yet. All their teeth aren't really in until they're like 2.5 sometimes. So they don't have the capability to chew up raw carrots and like steaks and stuff like that. So we don't want to give them anything that's like really hard to chew. They could eat like hot dogs, grapes, those round shaped foods. We just cut them into quarters, like not just half. You just handed them something that is the same size as their airway, So cut that stuff into quarter bites for them. So again, all their primary teeth should be in by the time they're 30 months, but they can have their first dentist visit. It's actually recommended to do that after they turn a year old, if they haven't already. Some parents are taking their kid in when they get their first tooth, and that's fine, but they need to do it by the time they're a year old. The parent should brush the kid's teeth. Toddler can help, that's not wrong, but you don't give a toddler a toothbrush and toothpaste and say, see you later, because whether they're just gonna eat it or chew on it, bite the bristles off, they're not gonna brush their teeth, right? They're not gonna properly brush their teeth. So the parent or caregiver should help them brush their teeth. We know that prolonging bottle feeding is associated with cavities because stuff just sits on their teeth. But like grazing, which is something, it's real easy to let your toddler graze throughout the day because they don't want to eat a lot at once, and you're like, well, they sit at the table and everybody's eating and they took their 3 bites and they're done, so like let them go play. Well, but then they want to eat again in an hour. Well, we got to talk about that. It's time to eat now, let's eat some. So and then go play, and then it'll be time to eat again in a little bit. So some of that is about setting a routine for them. But when you graze on foods, you just end up with stuff on your teeth longer, and it can like lead to dental cavities and stuff. Sippy cups are not really recommended as a regular thing that you hand your toddler, a sippy cup of milk or juice, because they'll just sip on it and kind of graze on it all day, and then the sugars from that sits on their teeth. Not saying you can't give them a sippy cup in the car, or, you know, while you're on a long trip or something like that. It's just, it's not recommended for them to just carry one around all day and just sip on something all day long. So it's better for them to try to drink out of a regular cup, and they do have the capability to do that. And that way, especially if it's milk or juice, it doesn't sit on their teeth. Fluoride is recommended if people live in an area where their water doesn't contain fluoride. If they live in more rural areas, they need to be using like fluoride supplement toothpaste. And then you run into, we don't want them to swallow that toothpaste because that has more chemicals in it too. So they do need fluoride on their teeth. But when they're brushing their teeth, that's why we supervise so they don't swallow the toothpaste. 12 to 13 hours a day of sleep, so this includes one nap. And then they can transition to a toddler bed. As soon as they're able to climb out of that crib independently, it's time to get in a big boy bed or a big girl bed. And that's a really big milestone for them to be able to do that. They feel very grown up when they get their own big kid bed. They don't need a TV in their room, or phone or device or whatever to watch stuff when they go to sleep. Bedtime routine is really beneficial for toddlers because it just helps them learn what's next, you know, and then they can say, I know it's time for bed, or I know when you say it's time for bed, they can go pick out their pajamas, or they can go pick out a book to read, and so on. It is recommended for them to have their own bed in their own space, but co-sleeping is a personal choice, just like breastfeeding. There are some cultures that practice that, and that's their choice. Even if they do, you can still give a toddler their own space in the house somehow, that they can sort of, like, this is where you keep your toys, this is where you keep your clothes, that kind of thing. That helps them learn boundaries too. So, preventing injury, this is a huge thing for our toddlers, right? We have to keep things locked away, safety gates on the stairs, locking the doors and windows, keeping sharp things out of their reach, the cabinet locks, all the things when you start child-proofing the house. And it happens, all of a sudden your kid is walking, and then you start realizing just how much they can get into all of a sudden. And you're like, well, I didn't think they'd be able to do that, but hold on, let me go put that up. So medications they might think are candy, right? If they see things that look colorful and that bite size, I'm going to try to eat it. So that's really scary when you think about a bottle of pills sitting in the cabinet that they can access, right? So keep everything locked. Store firearms unloaded, locked away, separate from the bullets. Cover the electrical outlet so they can't stick anything in it. Electrical cords are going to pull it. I mean, they're going to get into everything. Teach them to avoid unknown people, strangers, especially your kids that are very social. Like, if you want to talk to that person, that's fine to say hi, but make sure I'm with you. You know, make sure mommy or daddy is with you. Teach them to avoid animals that they don't know. They want to pet the dog, you know, but that dog might bite them. So you can't just approach a dog that you don't know, or any other kind of animal. Simple thing in the kitchen. Turn the pot handle to the back so that when they reach up, they can't just pull something down on themselves, right? That's just a simple thing you can do. Checking the bath water temperature. A hot water heater should be set less than 120 degrees is the safety temperature for making sure we don't get burns in the bathtub. Because even if it feels okay to us, their skin is a lot thinner and a lot more sensitive than ours is. And they can get burned easier. Of course, preventing fire, keeping your smoke detectors working, and then we kind of talked about choking. We don't give them a plastic bag, Walmart sack to play with, latex balloons, those kind of things they can choke on, small objects. So lots to think about with safety for them. Car seat safety, they're gonna still be rear facing until the height and weight limits are reached of the car seat that they have. So that could be different for different people, different brands of car seats. But we just teach the parents to read the instructions on the car seat. They need to be in the back seat, never in the front seat in front of an airbag. Of course, there's vehicles that only have a front seat or whatever, and the newer vehicles you can disable the airbag, but make sure they're not in front of an active airbag. Make sure the car seat fits them appropriately. So their head should be at least an inch below the top of the car seat. The harnesses are at or below the shoulders that are going over their shoulders. And the chest clip is like at armpit level. And whenever you try to pinch up the harness straps, they should be snug. You shouldn't be able to pinch up and pinch fabric up on them. And that tells you that your car seat's, that your kiddo's fitting in the car seat appropriately. 5-point harness just means that it's getting them coverage on their shoulders and their hips and in between their legs where it buckles, okay? And then remember, and y'all talk about this in infant too, but that, like, don't put a big old coat on them and then lock them in their car seat. They need to just be in regular clothes, and then you can cover them up with a blanket or something if they need it. And that's what it was. Or it was no car seat at all, right? This is just, it's either this or you're just holding them, you're sitting in grandpa's lap. Or you're in the back, right, of the station wagon. So this is just like CDC recommendations. We're rear facing, birth to age 2 to 4. That's a big range. So you have to look at the car seat, whatever the car seat says, to know when to face them forward. Water safety is super important because if a kid starts to drown, they usually don't make any sounds. They don't splash, they might a little bit, but once they go under, you can't hear anything. And so that's why they use this acronym for like educating parents, drowning is silent, because they don't really make a sound when they do it. So swim skills, toddlers can be taught how to swim early on. Have alarms. If you have a pool in your backyard, have something that goes off when that back door opens to know, but keep it locked also. But you have to put the locks way up high sometimes because they can reach. Layers of protection just means like locking that door, keeping an alarm on it, but then maybe they put a gate around the pool, those kind of things. I of our acronym here means you don't take your eyes off of a toddler when they're in the pool, basically. It's supervising at all times. And when they wear the little floaties, that's not really a substitution for supervision. It does help, but it is not like a substitution for it. Y'all see me getting my foot I try to hide one of those in all my lectures, by the way. I'm a huge nerd, sorry. But I do try to put that somewhere in my lecture, because I'm just, a nerd. Never leave the child alone, and touch is, don't let them out of arm's reach. Like, make sure you can reach out and grab them. You don't let them get too far away from you. All right. So pacifiers can be a good alternative to thumb sucking, because we can't get rid of a thumb, right? You can only put mittens on them or try to teach them not to suck their thumb. But pacifier, some parents don't want their kids to have a pacifier, and that's fine, but you can throw a pacifier away and you can make them all disappear, and that can be a hard transition too. But that's why pacifiers can be beneficial sometimes. But make sure, especially when they start getting more teeth, when they can start biting the pacifier and chewing it up into pieces that they can then choke on, it's time to get rid of the pacifier, you know. But just make sure that if you do use pacifiers, that they're all intact. They're not going to cause a choking hazard. We don't tie it around their neck. We do use this pacifier clips. That's okay, but you're with the kid. You're not leaving them, putting them down for a nap with their pacifier clip, things like that. So you're supervising them. with that. So toilet training, kind of already talked about when they're ready. Usually around 18 months is kind of the earliest, because that's when they can actually start having sphincter control. And that all has to do with that myelination and brain development. And their bladder capacity is getting bigger, and they can start helping you take their clothes on and off. But they also have to recognize when the kid comes and says, I need to go potty, and they haven't gone yet, they're ready. They're ready to do, so take them to the bathroom, and you can get them a little potty chair and, all the things that go along with that they can do on their own. Before that, they might start following you to the bathroom. They're gonna follow mom or dad to the bathroom because they wanna see what you're doing in there. And then they might start to mimic you. So these are all signs of readiness too. Parents have to be ready. You have to be ready to be calm with the child, because they're gonna have accidents, and we can't scold them for that, because it's just part of it. So we always use positive reinforcement. If they have an accident, okay, let's go get some dry pants and we'll try again next time. You did a great job trying. We'll try again next time, So that can be a challenge sometimes, but they will have accidents, that's expected. So use clothes that can get on and off easy, that the child can actually manage on their own, helps too, because then when they get into the bathroom, they can do the things by themselves as much as possible. Make sure their feet can touch the floor. It's not wrong to sit a kid on a regular toilet, but give them a little stool, because it just kind of helps give them some support. And then, it's better to have your feet where you can push against when you're trying to go to the bathroom, we kind of talked about this, but allow them to see their pee and their poop go down the toilet, and be like, bye-bye, and they know that came out of their body, and so it just helps them connect all the process. Use good hygiene, stay with them while they're in there, don't leave them in there by themselves. And sometimes you just have to take them to the bathroom. Let's go see if you need to go potty now. Let's go try. And they'll be like, I don't need to go. No. And they're like peeing in their pants, But take them to the bathroom and let them just sit there and practice sitting on the potty. Sometimes that can just be for a few minutes. Like, don't let them sit there for a really long time, but let them practice sitting on the potty. Again, bladder control usually happens before bowel control. Bowel control sometimes doesn't come till the end of toddlerhood. And then nighttime bladder control also takes longer to achieve, because that's a lot of hours. So it is more common for them to take longer to get control of that. But when they wake up in the morning with their first dry diaper, that's such a reason for, to celebrate, right? And you give them lots and lots of praise and rewards, and they start to understand how they can control their body. They're in control of that. But because their bladder is still small, they may just literally not be able to physically control it yet, and that's okay. So that just comes with time as they grow. So I have a little acronym. Usually, this is like signs of toilet training readiness. 2 or more hours with a dry diaper, like they wake up from a nap maybe with a dry diaper, that's a sign. They can get their clothes on and off, get on the potty independently too. They're interested in it. They like sitting on it. Experiences regular bowel movements. This is something that happens as they wean from the bottle to table food to eating 3 meals a day. Their bowel is growing, stuff takes longer to go through. They start having more regular bowel movements instead of, sometimes infants, especially breastfed infants, they stool more often. So just as they grow, stuff takes longer to go through their body, and that helps them with bowel control too. They come and tell you that they have to go, so that's another sign of readiness. Cute little kiddo. The temper tantrums. So again, ignore the behavior, but keep them safe. So if they are hurting themselves, then move them to another spot where they can't hurt themselves, but let them keep having their tantrum and as much as you can. And remain calm, right? Ha ha, sometimes. But it is really important because if toddler sees that when they throw a tantrum, you have a big reaction every time, or they like seeing reactions to things, even if they're negative sometimes. So it can kind of feed into it a little bit when you are not calm with them. So just making sure they stay safe, and don't put them in a room by themselves. When I say remove them and put them somewhere else, I don't mean put them in a room by themselves. I mean set them on the couch instead of the hard kitchen floor when they're banging their head, you know. So just make sure they're safe and stay near them, but try to ignore the behavior as much as possible. Never leave a toddler alone with younger siblings. If you bring a new baby in the house and you have a toddler, that can be very challenging too, because toddler doesn't understand why they're not the center of attention anymore. And we don't leave toddler alone with the baby because they will harm them potentially, and they don't mean to, but they just don't understand why that baby's crying or making sounds or whatever. Initially, the toddler's very interested in the baby usually, and they want to help and they want to see, but once they see, then they're like, oh, okay, I'm going to go back to playing with my own things. And I had a friend that had an 18, she was maybe almost 2, and she had a baby. And she went to the bathroom, 2-minute bathroom trip. Mom goes in the bathroom, comes out, and the toddler had taken a marker and drawn all around the soft spot. She outlined it for her, and drew around on her face a little bit, and was dragging her by her feet down the hall to show Mama. Look what I did, Mama. But they don't understand, right? So never leave a toddler alone with a younger sibling. Regression is common, especially if they're around a younger sibling or an infant comes in the house. Toddlers potty training, drinking out of a cup, sitting up at the table to eat, and now we want to wear diapers again and drink out of a bottle and lay in the crib. That's totally normal behavior. It's another one of those things where you kind of ignore it in a way, but redirect them. Remember you're a big boy, you're a big girl. Remember what you can do, look what you can do. And then reward them when they have that appropriate behavior. Transitional object, remember that's just like a stuffed animal or a blanket, something that's their special toy or their special thing that they only can use, That gives them some independence with that, and they can remember that they are a big kid and they don't have to do these baby things anymore. But they might try to regress, especially if you bring a new baby in. If they get sick in the hospital, we see toddlers will regress and have some behaviors like that. And it's just something you kind of have to redirect their behavior and kind of assess it at the time and help them remember the stuff that they already know how to do. And then when they do it, reward them and praise them for it. So negativism, they say no to everything, and I've kind of already talked about this a little bit, but when you are communicating with a toddler, give them an opportunity to say no when it's appropriate. Or ask them a silly question or whatever. Can a cat do this? Can a cat eat candy? No, or whatever. Can a dog ride a bicycle? I think that's the example it gives in your book. No, and they laugh. But we can decrease the opportunity to say no by giving them choices that are appropriate, or by using statements instead of questions. Do you want to go take a bath now? No. Do you want to wear your blue pajamas or your pink pajamas when you get out of the bath? You picked your pajamas, now let's get in the bath. So these are statements, things that you can make. May I take your temperature? No, what are you going to take away from me? Sometimes they take that very literally too. They think you're going to take something away from them. I'm going to check your temperature now. Hold your arm up, open your mouth, however you're going to take it, right? 2 to 3 acceptable options, if they exist, is enough. Usually 2, if you can limit it to that. If you give them too many options, that's too much for them. But that's where I was talking about, you want the blue cup or the red cup? You want to take your medicine with juice? You can take your medicine with juice or milk. Which one do you choose? Are you ready to take your medicine now? No. Keeping that mouth shut. So it's all about how you approach them sometimes, the reactions that you're going to get. So limit their choices, be really clear and consistent setting those limits. And then we've already talked about a lack of those boundaries and routine can really lead to uncertainty for them and anxiety. And when a toddler can be autonomous and make their own decisions and choose things, it really builds their self-esteem too. Timeout is useful. After about 18 months, they can understand that they have to sit here for, usually it's like a minute per age. But I mean, even just to redirect their behavior, that's a long time for a toddler to sit in one place for a minute or put their nose on the wall or whatever. Spanking is not recommended under 18 months because it can cause physical injury. So spanking is a choice, a personal choice of families if they want to use that as punishment, but it's not recommended to do that at such a young age. So our role as the nurse is going to be getting the family involved, especially if they're in a clinical setting. So now think about a toddler in a clinic setting or a hospital setting. And if the parents are there, I'm going to let them do as much as I can that's appropriate. We have to have good knowledge of what milestones they should be reaching so that we can recognize delays and know where they're supposed to be. And then just really encourage parents to set routines for their toddler and talk to the parents about what autonomy means. Like, this is what your toddler's doing, this is what they're trying to be independent, so let's let them do that safely as much as possible. Questions? These are my toddlers. They're not toddlers anymore, they're all big people, sort of. Questions about this before we try to guess a couple more toddlers, and then we'll take a short break.